USMLE style question on myotonic dystrophy. Question. A 28-year-old man presents to the clinic with progressive muscle weakness, difficulty relaxing his grip after shaking hands, and muscle stiffness. He also reports difficulty with swallowing and drooping eyelids. He has a family history of a similar condition in his father. Physical examination reveals frontal baldness, cataracts, and muscle wasting in his distal limbs. His serum creatine kinase, CK, is mildly elevated. Which of the following is the most likely underlying genetic defect in this patient? A. Mutation in the dystrophin gene. B. Trinucleotide repeat expansion in the Dmpk gene. Mutation in the LMNA gene. D. Defect in the CFTR gene. E. Mutation in the TR gene. Answer and explanation. Correct answer B. Trinucleotide repeat expansion in the Dmpk gene. This patient likely has myotonic dystrophy type 1, DM1, an autosomal dominant disorder caused by a trinucleotide repeat expansion, CTG, in the Dmpk gene located on chromosome 19. This genetic defect causes a progressive multisystem disorder with characteristic features. Pathophysiology. In myotonic dystrophy, the expanded CTG repeat leads to abnormal RNA processing and muscle dysfunction, primarily affecting skeletal muscles, but also the heart, eyes, and other organs. The repeat length correlates with the severity of the disease. Longer repeats result in earlier onset and more severe symptoms, e.g. congenital form. Key clinical features of myotonic dystrophy. Myotonia, difficulty relaxing muscles after contraction, e.g. inability to release a handshake. Progressive muscle weakness, especially in the distal muscles, hands, forearms, lower legs. Cataracts, often early onset. Frontal baldness and testicular atrophy. Cardiac arrhythmias due to conduction defects. Dysphagia, difficulty swallowing, and ptosis, drooping eyelids. Family history of similar symptoms is often present, and the disease exhibits anticipation, earlier onset, and more severe symptoms in successive generations. Why not the other answers? A. Mutation in the dystrophin gene, incorrect. Duchenne muscular dystrophy involves dystrophin mutations, leading to muscle weakness and cardiomyopathy, but does not cause the myotonia and multisystem involvement seen in myotonic dystrophy. C. Mutation in the LMNA gene, incorrect. LMNA mutations cause Emery-Dreifuss muscular dystrophy, which presents with joint contractures, cardiac arrhythmias, and muscle weakness, but does not cause myotonia or cataracts. Defect in the CFTR gene, incorrect. Cystic fibrosis involves chloride channel dysfunction and causes respiratory and gastrointestinal symptoms, not the myotonia and muscle wasting seen in this case. E. Mutation in the TTR gene, incorrect. Transthyretin TTR amyloidosis causes cardiomyopathy, peripheral neuropathy, and renal disease, but it does not lead to muscle weakness or myotonia. Key USMLE takeaways for myotonic dystrophy. Cause, trinucleotide repeat expansion, CT in the Dmpk gene on chromosome 19. Symptoms, myotonia, delayed muscle relaxation, progressive muscle weakness, cataracts, frontal baldness, ptosis, testicular atrophy, cardiac arrhythmias. Inheritance, autosomal dominant, genetic testing, CTG repeat expansion, anticipation, earlier onset, and more severe symptoms in successive generations. Would you like more details on